on it along the way. On the advocacy side, it was never really clear, although many of the advocacy groups ran ads for it, gave lip service to it, discussed it in various ways. It was really never clear that they really were 100% behind it. And I heard from many people as the debate went on in 2009 that it was basically a bargaining chip. It was something that they could give away in return for something else. And I had always assumed that something else was, let's get the pre-existing conditions clause removed, let's have some insurance market reform, let's find a way to get those 30 million people covered under some kind of insurance. And so I think that is what happened. There are some people who believe that the public option was kind of puny to begin with. Certainly there have been some writers on this who have advanced that theory. That is quite possible that it never really was robust to begin with, because if it were robust, it certainly would have been close to a single payer system, and certainly the stakeholders were not in favor of that.
Well, let's go to Margaret Flowers, Baltimore pediatrician and congressional fellow for Physicians for a National Health Program, who is definitely in favor of that. Single payer was not a part of yesterday's discussion. No advocate was there. Dennis Kucinich, not Physicians for a National Health Program. Your group asked to be represented, Dr. Flowers?
We did, because the president has stated that health experts should be involved in this process, and so we wanted to offer our services as people that do research in this area, and indeed they quoted several of our studies during the summit.
What happened? Why wasn't anyone represented?
Well, you know, this has been a series of throughout the entire health process that we've been excluded from this discussion. I think it's pretty basic. It harkens back to the special interests that have been involved in this process. You know, it's really interesting to watch this debate, because so many of the areas that the president and Congress are talking about, cost controls, increasing coverage, excluding pre-existing conditions, all of these would be met through a national Medicare for all system. So we win, you know, on the policy. But there is such a heavy influence from the insurance and pharmaceutical companies that they, I guess, felt threatened by the presence of the single-payer advocates.
Just looking at the report from the National Journal by Ashley Rodriguez, who writes, healthcare interests have given $46.6 million in campaign donations since 2005 to 21 lawmakers at the bipartisan healthcare summit, including Senator Max Baucus, Senate Minority Leader Mitch McConnell, House Minority Whip Eric Cantor, and to the summit's host, President Obama, according to this new report. And Citizens for Responsibility and Ethics in Washington found that health professionals, political action committees, hospitals and nursing homes, pharmaceutical and health product companies, health service firms, HMOs, and accident insurers have given heavily to all summit attendees. How does that affect this discussion, Dr. Flowers?
You know, we can only imagine that it affects it pretty strongly. And we saw that through the year, is that the members of Congress need to get reelected, and if they speak out against the interests who are funding their campaigns, they're not going to get that funding. So we continue to see these machinations around the dysfunctional situation that we have, and tiny efforts to try to patch it together, and we're missing the bigger picture entirely, which actually the majority of Americans understand, and the majority of physicians understand, that we are very different from other industrialized nations because we do not have a health system. We do not take care of everybody in our country, and we actually could do that. We have a program that's been working very well for 44 years now in this country. It's a model where people can choose which doctor they want to go to. Doctors can choose the treatment for their patients without insurance companies interfering, and it's also the model that will control healthcare costs and be much more efficient in our healthcare financing. Because we have this system of multiple private, for-profit, or profit-driven, really, insurance companies, their bottom line is not health, it's profit. We're wasting a third of our healthcare dollars, for over $400 billion a year.
Of course, you're talking about Medicare and just dropping the age of eligibility to include everyone. But what about now? Even the public option is off the table. How do you feel about that?
Well, the public option was a very vague concept to begin with, and so many people didn't really understand what it was or didn't have faith that a public option could keep a giant insurance company honest. We have seen evidence over and over at the state level that you can't keep these insurance companies honest by having a public program. What happens with the public program is that that's where all of the people who actually need health care end up, and the insurance companies continue to avoid the sick and deny and restrict care and make huge profits. So that it wasn't a concept that people could really understand, but a national improved Medicare for all system is very simple to understand because we've seen it working here in this country. It's familiar. And so by excluding, I think, by excluding that viewpoint, we really missed an opportunity to push for real reform because the people do understand national Medicare for all.
We just have 30 seconds, Dr. Margaret Flowers, but what is the plan of single-payer advocates, of Medicare for all advocates at this point?
We're going to continue to move forward. You know, I think it's pretty clear that Congress is not going to be able to do this if left to their own devices. And so we as a people are going to have to educate ourselves and get active and get much more involved. And Senator Harkin alluded to the fact that there's segregation by health status in this country. We can't allow that to continue. It's not acceptable. So I hope that more people will get involved with this movement. We're certainly going to continue to move forward and push for this.
Dr. Margaret Flowers, Baltimore pediatrician, Congressional Fellow for Physicians for a National Health Program. She was arrested when she spoke out in Congress trying to get single-payer advocate included in Max Baucus's, the Senate health care leader, Senate leader of the Finance Committee, getting a health care advocate who supported single-payer in the discussions in his hearings. Also, Trudy Lieberman, thanks for joining us from here in New York, contributing editor to the Columbia Journalism Review, blogs at cjr.org. This is Democracy Now!, democracynow.org, The War and Peace Report. Back in a minute.